assessment that I use with all my clients. This is not to assess any dysfunctions or anything like that. We leave that to the physical therapist. This helps me just understand what exercises might be good and what might not be so good for my clients. Check this out. Bring the camera in here for a second. Deanna's going to relax her legs, so relax your muscles, Deanna. What I'm going to do is I'm going to take my thumb and put it on her tibial tuberosity. That's the top of her shin bone. And just to make sure I'm in the center of it, I'm going to kind of flip-flop my thumb from side to side until I find the center. So that's the top of her shin bone right there. Then with my other hand, I'm going to go on each side of her patella. And what I'm going to look at now is draw an imaginary line from my thumb in between my fingers. And you notice if I drew that line, my thumb is very close to one of my fingers. So that means that we have kind of an alignment issue. The ideal situation is my fingers would look like that, and my thumb would be fairly center. I mean, there's some room for differences there. So let's look at symmetry for a second. So let's go here, tibial tuberosity, and if I bring my thumb up, you see it's almost outside. So ideally what we're looking for, if you look at my knee, just relax for a second. So here's my tibial tuberosity, and here's each side of my patella. So if you drew that line, you see it's very, very centered. Now, Deanna doesn't have any knee pain. So does this mean that she's dysfunctional or she's going to be on the surgery table anytime soon if she does lunges and jumps and whatnot? Absolutely not. What this lets me know is that certain squats and certain lunges might not, or certain other exercises like leg extensions, might not be as good for her as they would for someone like me. So for instance, with someone whose knees are kind of medial, a lot of girls you see this in, I wouldn't give leg extensions to. I also, here check me out for a second, I also wouldn't have lunges, I wouldn't have her do lunges with a purely vertical tibia, because there's a long lever arm here and most of the force is right through her knee. That's why it's called a knee dominant exercise. But when we have a knee that's already dealing with torque, why am I going to push that knee further than it should be? So I might let her lunge with a slight hip hinge to bring the glutes in and take some pressure off the knee. Another exercise I probably would not have her do is reverse sled pulls. It's, again, putting direct pressure through her knee. It's like a standing leg extension. When we have her squat, we want her to squat wider stance because she can use her hips a little bit better. If she goes parallel, there's going to be a lot more force through her knee. So like I said, as a trainer, it's my job to figure out exercise selection, not to assess dysfunctions or anything like that, because she controls this just fine. She compensates for it very well. There's nothing wrong with compensations. But this helps me better figure out what exercises to use and not to use for her. So, simple assessment there, thumb on the tibial tuberosity, fingers on each side of the patella, and see where the alignment is. Ideally, you want that thumb to be fairly centered.